we are going to get started. Hello again, all of you. For those of you who don't know me, my name is Abby Wilson. I'm a registered nurse, dietitian, and a certified diabetes educator with Portneuf Medical Center. And we've partnered with the Healthy City team to bring you some healthy living, specifically for New Knowledge Adventures. For those of you online, hello. So today, I know the class title was Get Some Pep Back in Your Step. Part of that is going to be discussions around life planning. Now, I'm going to give you full disclosure. This is not my area of expertise, but it is something that we feel is really important as we think about aging, right? And we're going to dig into some things that we just want everybody to remember, to be working on, or if you have already done these things, maybe revisit them and make sure they're still up to date and accurate. All right, now for those online, if you have questions, just enter them into the chat and Michaela will help us stay on track with those. But we will start out with what is lively life planning. So making healthcare decisions for yourself or someone who is no longer able to do so can be very overwhelming. That's why it's important to get a clear idea about preferences and arrangements while you can make decisions and participate in legal and financial planning together. So this comes from the National Institute on Aging. We dipped our toes into this about 2 classes ago, or last class when we talked about end of life nutrition. Now we're going to look at the bigger picture. We're going to zoom out. We're going to talk about the importance of relationships and support systems. We will touch on aging in place. We will also discuss healthcare and mental wellness, resilience, and some things you maybe haven't thought of. And we will also, again, we're not experts in the financial area of this, but putting some things on your radar. So our team, just a refresher, our team at Portneuf Diabetes Education and Nutrition Services is a mix of nurses, educators, dietitians. We interact with lots of pieces of this through the life span of someone that we might be seeing. And we believe that these are really important topics to discuss, both for health, but also your peace of mind. I'm presenting this through the lens of which I work. And my colleague, Jennifer Wilhelm, helped pull this together as well. So let's talk about relationships. Does anybody want to add or comment on maybe what is different in our silver years regarding relationships? What's been on your mind? And I know that's big and broad. Okay, so loss of longtime friends. Okay. Okay. Yep. And family members too. So loss of friends, loss of family members, just kind of experiencing that transition. Does anyone want to share where they're finding new friends? NK, right here, right now, which is great. Yes, doctor's offices, sure. Senior center, I like that too. Now, I think it is so much different. I think along the lifespan, right, of finding friends, I look at my 4-year-old right now, and it's pretty easy to say, dude, I like your shirt. Can we be friends, right? Very different at different ages. But you know what? If you're brave, that's also a good opening line, right? To meet a friend. So the reason why we bring this up is because we know things can become a bit sparse, a bit lonely as we age. And we want you to think about if you were hospitalized tomorrow, who would help you with anything? Is it your loved one at home and maybe they're the one who needs help while you're in the hospital? What about your cat, your dog, your fish, your plants, your yard? Who's helping stay up on the mail? Who's helping you make sure you get your bills paid on time? This is very fresh in my mind because I have a loved one in the hospital right now. And things are very different where we don't have statements necessarily coming in the mail for everything. There's a lot of stuff online. So it's like, oh, where's that password? What's that login? And I'm going to curse right now, but I'll be damned if there's dual authentication, depending on somebody else's cell phone somewhere, right? So these are all great things to keep our lives secure, but boy, is that challenging to think about. So those are pieces I want you to be aware of. What if there's snow that needs to be removed at your home? What if you have mail delivery prescriptions that are sitting on your porch? Maybe it's July and it's 100 degrees outside. Who's picking that up off your porch? So, thinking about that transition and how life is definitely a trip, sometimes a health event can really be a long road in itself. So, we need translators, chauffeurs, janitors, handymen, mechanics all along the way. And from our lens, some helpful resources, and we'll talk a little bit more about them at the end, are the Area Agency on Aging, but also thinking about all these options before road bumps even occur. So, thinking about the members of your tribe. So, I think non-emergent medical transportation is under-tapped business. So if you all are needing a new entrepreneurial adventure, this is something that's growing in our community, but we wanted to bring awareness to a company called Shuttle. We are not affiliated. We have no financial investment in them. Yeah, yes, yes. And we're going to talk about that too. Yeah. No, you're okay. Yes, so PRT is great. So we have a few things in town, and it also depends on where you're at too, because sometimes you can access non-emergent medical transportation through Medicare, Medicaid. Sometimes you have to be a certain age to qualify for some of those services. You may have seen Shuttle, they have blue and yellow cars in town. But you can schedule them for almost anything, medical appointments, grocery trips, etc. The nice thing too that we've seen is that they're trained to help you get in and out. So let's say you have a fresh new hip replacement and it's your 4-week follow-up with your orthopedic surgeon. This is someone who can help you transition out of the car, and sometimes they can handle multiple appointments per week or even in a day. So PRT, so this is fantastic. So they do door to door. They also do rural and county services as well, which is great. Most of those PRT transportation also can handle a wheelchair, which is good too, or even potentially an electric chair. So these are resources. You have to be able to access some of this online, but at least to get a phone number, you can call and make those arrangements. So, Area Agency on Aging, who's familiar with this group? Okay, okay. So, our state has different zones, regions, districts, if you will, that support our aging population, and they cover nutrition resources. So maybe you need access to Meals on Wheels, or there's even other programs that they're associated with that if you do need meal home delivery that is medically tailored to you, they have links and resources for those. This is where we've got a lot of our transport information. There's also resources to get connected to a homemaker. So if you are in a position, maybe you just had your shoulder done, and you need some help getting your house cleaned and doing laundry, running those errands, even just getting your hair washed can be challenging at times. And they also have a lending closet, which is really great. So if you are looking for things like a walker or maybe even bath benches, or even if you have some of these things you want to donate, this can be a really great group to reach out to. So we've mentioned this term a lot in our class this spring, and that's the idea of aging in place. What is wrong with this picture or concerning about this picture? No grab bars. Oh, yeah. How do you get in? How do you get out? I love this. But I also am like, yeah, right, right. The plant, the lamp. Now, the lamp could supply some extra lighting, I guess, at nighttime. Yeah. So there's a lot here, right? So when you are thinking about aging in place, maybe you have this beautiful bathroom. That's great. But have we considered what this looks like as our mobility changes? So thinking about rails, benches, stairs, rugs, lighting, that accessibility. And here's just some of those options, even just thinking about that, right? So we see a ramp getting into a location. There's, you don't have to have a hospital bed per se, but there are mattresses that raise and help you get out of bed. Same thing with chairs. A bidet is always nice, whether you're aging or not. And then we have this, I don't know very many people who have these, but if you have stairs and if you have the assistance and funds to get an electric chair to take you up the stairs, those are pretty great. Also, just even re-envisioning your fixtures in your shower. So, thinking about something that has a handle that you can bring down to you can be helpful. You see over there, everybody's kind of got their own feelings about AI, but Alexa could maybe be a good tool in your house. That's Amazon Alexa or Siri. Maybe you talk to Siri a lot to set timers and reminders and things for you in the house. There's some new technology. I think it's still in like beta testing, but there's some cool things that I've seen through a program that I'm in right now that you have the potential in the future to have a virtual assistant to help you remember take your medications. And it's even like if you can imagine being on an iPad and there's kind of a two-way mirror, if you will, they're kind of overseeing you take your medicine, but you can also watch yourself take your medicine. So if you're having a little trouble remembering, you can kind of have that moment where it's very intentional, very mindful, reduced of distractions, but they can help remind you to take your medications. And I foresee that coming more and more into the future. And even adaptive devices, so different grips for your silverware if your grip strength is changing, or if someone's had a stroke and they're having some weakness of their dominant hand, these can be really fantastic. So the AARP has amazing resources as well, and they have a great home fit to-do list. So looking at this is a pretty extensive list from everything from your entrances to your exits to your kitchen to your steps and stairs. But questions to kind of consider. Do we have a bedroom on the main level? Or is there a room, even if that's not your primary bedroom, do you have something set up if in the event you are restricted on stairs for a period of time, that can be your bedroom? Is this something that we can get in and out of bed easily with? Do we need risers? Night lights, even light activated lights, can be a fantastic tool. Having secured rugs. So, rugs are great to kind of keep those wood floors for all reasons, aesthetics, warmth, all those things. But rugs are definitely trip hazards. So, we have double faced rug tape to keep those rugs in place from their corners flipping up. And then when thinking about updating furniture, consider purchasing chairs with armrests. So there's a lot of beautiful chairs out there that have no armrests, but as we age, just having that little extra assistance to get up and being able to put our support and support ourselves on those armrests are great. If you're still interested in gardening, considering transitioning to more raised beds, maybe some flower pots and less things down into the ground. And also consider exterior lights. I don't have a picture of it, but there are, I think for a pack of 6 or a pack of 8, Amazon sells these, they're triangle shaped lights that are solar powered that you can stick right on the outside edges of your steps into your house. And so they're not anything that needs a lot of expertise in installing, but that can give you some lighted pathway as you're coming and going at different times of the morning or evening. And then also thinking about a snow removal plan. I think that this is sometimes an afterthought, and then um, we obviously, it's spring in Idaho. It could be snowing like it was yesterday and then melt off. But as we know, most of the time during December, January through February, it stays. So we need a plan for that. So I love this from this gerontologist. I think this is really wise. Every year when you do your spring cleaning, maybe take one extra step towards a friendly aging house. So thinking about maybe this year focusing on lighting, but maybe next year prioritizing saving some funds for things like grab bars in the bathroom, or even remodeling the base of a walk-in shower to make sure it's something that maybe you can wheel a wheelchair into there if you need to at some point in time, or just lowering the threshold to step into a shower. But thinking about mapping those out so you can make a little space and schedule some time to prioritize that every year. But maybe your plan is to age into a home that is new to you, but in your community. So some folks might consider downsizing, looking more at community type living. There are, I don't know so much around here actually in Pocatello, I've not looked, but 55 and up locations, that is the only group that's allowed to purchase in a neighborhood, or considering living with family. Now, this is a concept we've talked about before, but this is just a gentle reminder. At this point in time, we're training for life, right? And if you are training for a triathlon, cool, but really we're thinking about this stuff. um, but we want to think about getting up and down from the ground, getting off the toilet by yourself, lifting things overhead, whether that's travel or just doing work around the house, or maybe those awkward cupboards, we're kind of moving less used things a little bit higher if we need to. And then keeping up with endurance. So keeping the heart healthy and considering walks with packs. We've talked about resistance exercise with this group. Walking with a pack does count as some of that resistance exercise. So having a small backpack that maybe you can pack that with anything, but even just throwing a couple cans of soup in there can be helpful to add a little bit of weight. And then looking at hikes, so you're getting some variability in your elevation, but also just thinking about connecting that mind to your feet, getting that good exercise because you're going to be on uneven surfaces often when you're hiking. Any questions on those things so far? Okay. All right. So thinking about healthcare and mental wellness. Resilience is a term that's used more and more, and some of us have this kind of an innate built-in resilience, but sometimes it has to be trained and practiced. So we think about emotional resilience and physical resilience, thinking about mental and emotional aspects of aging, and also going through the coping or even grieving process of maybe not being able to do all the things you used to be able to, and also coping with changes in health, whether that's a new diagnosis, a progression of diagnoses. But thinking about what helps aid in resilience is having these protective factors. So coming back to those relationships, is there a neighbor? Is there a friend that they're just your go-to, you're each other's emergency contacts? Staying active also aids in resiliency. Thinking about optimism. A few classes back, we talked about even just gratitude and how that fosters a lot of optimism. Looking at your spirituality, if that's something that is near and dear to you, whether that's through church or other practices. And then our ability to manage the stress around times of turbulence. All right. The stealthy UTI. This is really a bugger. So thinking about UTI awareness. So urinary tract infection is what UTI stands for. UTIs, the older we get, the less likely we have symptoms until they're way out of control. So being aware of the non-physical symptoms. So some people might have just an increase in urgency or frequency, burning, pain, lower abdominal achiness, fullness in their bladder. But sometimes people don't feel anything until their loved one is like, you are batty. You're going crazy. What is wrong with you? So, but thinking about what a UTI can unfortunately cause would be an increased risk of falls and potentially just confusion and not just feeling clear. So these are things that we want to just bring your awareness to. Even men who have an enlarged prostate are at an increased risk of UTI. But women specifically, we are much more at risk. But the Area Agency on Aging has a bladder control class. So this is a tool that not many people are aware of. Okay, coming back to building your tribe. So thinking about other aspects that you may want to just have a pulse on. This might be within navigating your own insurance plan. So if you have something outside of traditional Medicare, maybe you have a supplemental plan, or maybe you've purchased something through more of a commercial insurance that acts like traditional Medicare. But what are your home health agency options? Do you have friends who've used home health and maybe they can give you a good recommendation because they've had a good experience? Occupational or physical therapy, who might be those agencies that you would want to consider? Just thinking about what are your options as you age. Is an assisted living center something that you are interested in? Maybe taking some time to schedule a tour and understand what that process would look like. Also thinking about respite care, maybe both for you if you are the caregiver of someone you love, or maybe just that next step, thinking ahead if you need to have respite lined up for the person caring for you. And then looking at if you're married and you're still with your spouse and they're still with you, what are those divisions of responsibility in your home? Again, coming back to bills. Does everybody have relevant count information? Do we know when bills need to get paid? Do we know what those things look like? Because in the event that can be really disrupting if one person's been the primary driver of that. And even on the flip side, I think kind of very traditional roles, if the husband in the household is managing some more of the payments, I don't know, some women are much better at that, but but maybe that's a role, and then wife does more of the cooking and cleaning. But all of a sudden, if wife's, had a hip done or is in the hospital and is unavailable to do those things, it can be very disturbing, both from a financial aspect and even just a nourishment and like household task management factor. So maybe taking a little time to divvy those up a little bit differently so everybody feels comfortable if something were to arise. I think this one is really important too, partnering with a friend for animal care. I'll never forget probably my first year of being a registered dietitian. I was an inpatient dietitian and I worked a lot in the ICU. And I had a gentleman who had lost most of his support system. He was probably late 80s, and he had two cats that he was so concerned about because he knew he wasn't going home to them. But just making sure you have a plan for that, because man, if I could have taken his cats, I would have. But just thinking about that too, and having a place for your furry friends. All right, so finances and forms. So be the CEO of your life. Things you need written down. Who is your primary care doctor? How does someone get in contact with them? Even knowing what clinic that they work for can be very, very important, because maybe it's someone who has kind of a mixed practice. They do some urgent care, they do some work at maybe a skilled nursing facility. Sometimes if we don't know who they are, depending on what area your primary care doctor works in, and we Google who that is, they might be associated with 3 different clinics. And where do we start? Okay. So having an idea of exactly who they are and their contact information. Having relevant healthcare documents. So we've talked about medication lists before. I would consider that a healthcare document. Just knowing your health history and having that written down, even your surgeries, so we're aware of those. And then we talked about assisted living, but also we want you to think about what are your long-term care considerations. So there's different variations of this. If you are leaving the hospital, this could be something like a skilled nursing facility. This could be looking at assisted living. This could be home health. So having some things kind of just sketched out of what your insurance or who your insurance would work with. If you have a will, where is it? Does somebody else who cares about you know where it is? I don't know anything about estate planning, so don't ask me about those. But as far as estate planning, if that is something that you've worked on, where are you in that process? Are the right people involved? And then if you haven't started, please start. Okay, so getting more into those healthcare documents. So a durable power of attorney for healthcare. So this is a very, very important document that dictates who legally can make decisions for you about medical treatment in the event you cannot make decisions for yourself or communicate. This often usually needs some type of notarization. So just kind of giving you a heads up on that. But this is something that your primary care provider should have on file. If you have any services at Portage Medical Center, for example, that are outside of your primary care, make sure one of those providers has this as well. Because if you are at the hospital here, we can have the beauty of that Epic or medical record system that they use is that will be there. So if you are in an emergency situation, it will be on file. Having an advance directive. So this is another component kind of similar to what we talked about with end-of-life nutrition. This gives instructions to the medical team about what you want in the event of an emergency. So do you want life support? Like, do you want a machine breathing for you? Do you want to be intubated? Intubation is also different than resuscitation. So intubation might be something that is done more therapeutically. Maybe your body's not able to manage its blood pressure and breathing very well on its own, but it's not something where your heart has stopped and we need to do CPR. So those are things to consider. What do you want in that? And your primary care provider can also be a resource to talking about this and what this means. But these are two very important things to have at all times. So a living will is a part of the advance directive. This gives you more details of that life-sustaining treatment or end-of-life plan that what you would want. A post form is a physician's order for scope of treatment. So this just looks at, for even further detail, if we are facing serious illness, how much care do you want? How much care do you not want? And then looking at your long-term care considerations. So assisted living, in-home help, we've talked about those things. Family financing for these things is really important. I know that there are different insurance brokers, if you will, that can help you look at this very in depth to say, okay, if I do need to go to skilled nursing, how many days will be covered by that insurance plan? Is there one that can do better? Is there one that has some financing for more medically assisted, but not necessarily fully skilled living? And I think the most important thing is just exploring and discussing this and making sure your family is aware of what your wishes are. So coming back to the estate planning, the very little bit that I know about it, a will can be a part of your estate plan. But thinking about this is kind of that business aspects of death for your family and friends. And think about your who. Because that also can become a very tense conversation for individuals if you're not able to speak for yourself. So looking at resources, the National Institute on Aging has a great guide around advanced care planning. The Area Agency on Aging you can go to their website, but there's also individuals you can talk to, you can call, and they have fantastic resources. They even have packets and kits for all these things that we've talked about, like starting a living will or having some of that paperwork pulled together for like a post or advance directives. Okay, so we've cruised through that for today. This is a shorter class, but do you guys have any questions? Yes. Mm-hmm. Mm-hmm. Yes. Yes. So that's a great question. So there are very many new devices out there that you can use for Life Alert. Those tools sometimes just help you. Let's say you've fallen, but it's non-traumatic. Sometimes pushing those buttons will just get the fire department boys to come help, and they'll triage and see what they can do. But that should be a part of your aging in place. And I think that that could be an important tool if you are living alone or even if you have a spouse or a roommate, because sometimes they travel, they might be out of town. And so having that is a good resource. I would say medical alert bracelets are also really valuable in that. So if you have diabetes or if you have a pacemaker or something like that, you can get different bracelets for those. What other questions? Yeah.
Medicare healthcare advisor to walk you through all the.
Yeah, that's a great question. So I believe, and I'm trying to think of what the acronym stands for, but the SHIP office in town, or Sheba, thank you, Sheba, is a very good resource. Um, and I would say they're probably the most, from the bit that we've interacted through our clinic, they're probably the most neutral. Yeah,
Great advice on what kind of healthcare plans you want to get.
yeah,
My specific question is related to instances where someone has had a traumatic issue.
uh-huh,
They're in the hospital.
okay,
Going in.
yeah,
Issue.
okay. Nope, I get it. Sure, sure.
An independent person might say, beware of this, or if you do this, this is going to happen. It's
Mm.
sort of thing.
That's a really good question. Michaela, can you write that down and let me get back to you on that in our next class or the class after. I would like to look into that and see. Okay, sure, sure.
The other,
Yeah.
someone is, they need I guess I call it a trustee,
Mm-hmm.
financial issues while they're incapacitated.
Yeah. Mm, I do not, but let's add that. I think that that would be another good discussion to have. And maybe Michaela too. So our last class, we have a guest speaker coming from the Agency on Aging, right? And maybe those are some questions we can send in ahead of time, since they would be a good expert on that. Um, because because that's a really great question. I feel like there may be some personal finance and accounting firms that may offer those services, but I don't know to like what surcharge, like what that kind of looks like. But that's a good question. So let's ask them those questions ahead of time. Okay. And if you need help, how do we should phrase those? Let me know, because I think the hospital advocate is a really good question too. Yeah. Yeah. I know that sometimes if someone's in the hospital alone, with no guardianship or family available, there are community trained volunteers that the hospital can call in to be that person's advocate and help navigate decisions if they don't have someone speaking for them. But if there's, other things, just kind of navigating the best choices around cost and when and discharge, that's a great question. What other ones? I love this because this also, if I don't have the answer, we're going to make the list to find out who does. Yeah.
But I think as we get older and, lose people in our lives and things, we need to be aware that being alone isn't the end of the world.
Sure.
And as far as
Sure.
alone, I think we take a paradigm shift on being alone as time for ourselves to enjoy what we like, music or
Mhm.
special program or something.
Yeah.
That a lot of it, I think, is mindset.
Mhm.
Yeah,
Yeah.
providing yourself some quality alone time as opposed to being lonely.
Right. And I actually love that you shared that. I think, we talk about, like you said, like loneliness, but there's also a difference between being lonely and alone and thriving too. And I think just recognizing that, I think I personally even relate to this right now. I love my husband, but I'm like, yeah, if I could go on a trip by myself, I'm all right with that too. And I love him dearly, but boy, sometimes you just connect to yourself in a different way and see that as a new opportunity to find new hobbies or really get back into something maybe that you've been unable to do. I love that. Thank you for sharing that. Yeah, it doesn't have to necessarily be negative. And I think our culture, we've talked about this before, but in the United States, I think our culture is very stuck on the downsides and the grief and the loss and the death and the dying versus like being able to reflect back on the beauty of life and all that it's given you and the balance of having duality in things. You can also have some grieving, but you can have a lot of happiness at the same time and acknowledging that duality exists. Some things can be very hard, but also very beautiful at the same time. So I think that that's a great add. Anything else anybody wants to share today? Hmm. Yes. So for PRT, you do have to give them at least 24-hour notice. Hmm.
Grocery shopping?
Hmm. Yes. Yes. And that like really PRT is a fantastic service.
I figured I would have a point where I could drive myself to my activities that I like to go to. Because all the rest of my support system works.
Hmm. Yeah.
So that,
Hmm.
I don't want to miss those activities.
Yes.
They're a part of my daily.
So will they come to the house and pick you
Yeah,
up and
they will literally come to
Okay.
the house. And if you're in a wheelchair, they'll even assist you.
What's the cost of that?
$4.
It's $2 one way.
Yep.
Actually, for over 55, if you can't afford it, they're not gonna charge you.
I mean, but there are
But there
programs
is-
to that.
Yeah.
Yeah. Yep. Yes. And it is great. And what I love about the PRT too is I think about, Pocatello, Chubbuck proper, but really they do rural driving as well. So if you live outside, it's great. Yeah, yes. So, but there's some scheduling that can be done with that. I will say, just from the clinic end of things, if you do use public transportation, I would just encourage you to pick an appointment earlier on in the day, just in case your driver does get hung up. So if you're the last appointment of the day, most people will stay open for you, obviously, but I've had some patients who have had almost a 30-minute delay sometimes of being picked up, or if you have multiple appointments that you need to be at in a day, be kind of thoughtful of where you give your self room. Mhm. Yeah.
If people can't drop it off,
Yes.
they drop it off.
Yes. So,
They have to help somebody or something that might be wrong.
mhm, exactly.
One day it might be one person that trip, it might be 15 people that.
Yep.
Yeah.
And that is true too.
Deal with situations like that is not end up 'Cause I had a situation where I was a single parent. And I went into emergency surgery, and my kid was at school,
Mhm.
and it was like, what do I do? So I called a friend at the last minute to take care of and pick up that kid.
Yeah. Yeah. I think that actually raises one other question I want to, or a thought I want to add on that. If you have grandchildren that you are heavily involved in, or maybe they're yours, maybe you were the primary guardian of those kids, there is, and I'll see if I can get this information too. And I definitely always have reservations, right, of people you don't know driving around your kids. But there is a service in town. I think it's with Yellowstone Transportation that they do childcare pickup, drop off. They'll help get kids from school to after school care, and can help with those things as well. I don't know how much it costs, but they're trained to work with kids and are certified to do that. So, and that's a newer service in town. Hmm.
And slowly progressed myself. I have Parkinson's. And so I think of things that I may have to deal with in the future, and I research it ahead of time and prepare myself for it.
Hmm. And I think it's so important. And also too, the list that we've talked about today, I think coming back to your point as far as, optimism and making the best of our situation, that's what we hope to do right now, right? Is get this list together so when those times come, you feel confident, you have answers, you have a plan, or at least have somewhat of a plan, and feel secure about those things. So, yeah, even as simple as having I think about like the hospital bag that you have when you're a mom getting ready to deliver for a baby. That's good for anybody. If you have a designated toiletry kit, because I'm going to tell you the roll-on deodorant and the soap and stuff at the hospital, they help you, but it's just like hotel soap, right? So just feeling fresh and those things, I think that it's important to just have that to say, hey, can you get this bag? It's this color, even designating it some, it could be red, it could be some ridiculous hot pink, something that's very visual in your cupboard at home to say, can you grab this for me and bring it to the hospital? That can be helpful. Yep. Yep. Hmm.
Well, and I can't ever tell them when they say, well, what do you take and how much? It's like,
Well,
I
my
can't
mom-
remember.
And for why. Mhm.
He would always complain to them because he wasn't getting his medication on time.
Like they didn't know.
Well, she kept trying to tell them that he needs it this time frame, and they said, no, we're gonna do it here, and so, they don't always have the time
Yeah.
to take
Sure.
care of them.
And I will say, and I'm very passionate about everyone having medication lists because depending on your needs, you may have multiple providers in your care who are individually, but also team approaching your medications. And depending on how and where they're dispensed, technology is getting a little bit better. Some electronic medical records can pull information from pharmacies, but even sometimes what comes through is not necessarily how your doctors directed you to take it. So making sure that you have that very well understood and written down and the reasons why you take it. You might take something like hydroxyzine for itching while somebody else might take it for anxiety, or you might take propranolol for this, but you might actually, for heart rate, but somebody else might take it for migraines. So it's really, really important that you understand why you're on what you're on as well and have that written down because some medications have multi-purpose use. Mm-hmm. Absolutely. All right, everyone. Well, I hope you enjoyed lunch. Michaela, do we have anybody online with any comments or questions? Okay, and we'll come back with some answers to a few great questions today. Thank you all.